this. Neera, hasn't the president misled all of us about the possibility that we could lose the plans we have?
So, first of all, on these, I haven't seen these estimates of 14 million people from employer-based coverage.
That was from CMS.
That was a higher coverage. CBO has done projections since then that are much lower than that. So, I think we should really find the facts on these numbers. So, but first and foremost, I would say, look, the president has apologized for the issues around loss coverage for statements he's made, but we should recognize what's happened here, really, which is that people they're getting insurance notices that they've lost coverage, but there are other plans available to them, and 70% of people actually will get subsidies for health insurance. What we aren't seeing in these data is how many people will be better off from the Affordable Care Act. We're only focused on the insurance loss plans, but there are better plans for many of these people. And I think that's what's gotten really lost. And the fact is, we have hundreds of thousands of people, and hopefully at the end of this year, millions of people who will get better health care than they had before.
I want to pick up in coverage in a minute, but I want to ask Jim the same question. Is it or is it not the case that this isn't just a question, an issue, a problem with people with individual policies, but that a lot of people who get their health insurance through their small business employer or even big corporations are going to lose that coverage?
They will. The law requires, especially small businesses, to pay premiums as a large group now. So lots of businesses that are signed up through 2014 are going to get notices in the coming months saying, hey, you can't get your old plan anymore. It's the same problem that individuals faced. These problems are going to wipe all the way out through the small business community.
Can I just make a point about this? James Capretta has a health care plan that he's put out, that he asked for tax credits. He said we should convert the employer exclusion to tax credits. Estimates of that were that there would be 11 million people who'd lose health care coverage, the coverage they have, and they'd be dumped onto different kinds of health care plans. So I have to, and you know, John McCain put forward a health care plan that had 20 million people lose their coverage that they had. So without better alternatives. So I think the idea that conservatives...
With all due respect, I don't want to get into the plans that don't exist. I'd like to get into the plans.
I'm just saying, I think it's a little hypocritical to hear complaints about coverage loss from someone who's authored a plan himself.
All right, 30 seconds to respond about a plan that doesn't exist.
It doesn't exist, no, but it's your plan. So criticizing the president for a plan that would have less
we have your point. It's Mr. Capretta.
She's wrong.
The
plan that I drafted, which I'd love to have Congress and others people consider, would not actually affect the vast majority of people in employer-based coverage because it wouldn't change the exclusion for them.
That's true.
Okay,
There's millions of people
guys,
that would be
I'm sorry. I want to talk about Obamacare. I don't want to talk about Capretta Care.
I appreciate that.
All right, let's turn because you brought up, and it's an important thing. This isn't just an insurance issue. It's a coverage issue. It's the health care that you're going to end up getting in the end. Jim, is it true that to cut costs, that many of these new plans under Obamacare will sharply limit your access to doctors and hospitals, much as